Good evening once again, folks, and welcome to Doctor on Call. It is Tuesday, the 28th of July 2020. This evening we have with us Dr. Devron Joseph, and we will be talking about the liver and some of the problems that we can encounter, with our liver. In fact, today is World Hepatitis Day, and it's one of the common conditions associated with the liver. Let me welcome our viewers of GBN Television, Channel 7 and 11, and of course, to all our listeners of K105 FM. Dr. Devron Joseph, welcome to Doctor on Call. Again, you're back with us.
Thanks for having me. Again, first time in this Zoom format. It's a bit different, but I'm here from the comfort of my home, so it's a bit different, but all in all, a comfortable setting.
Yeah. Compliments COVID-19. yes, indeed.
The new normal.
The new normal. So this evening we talking about the liver. Today is World Hepatitis Day, and I want to start by asking you to tell us a little bit about the liver, its importance in our system.
Okay. All right. Well, the liver is a solid organ in the human body. It's located in the right upper part of the abdomen, and it's quite an important organ. It's responsible for a lot of the synthetic function. It produces a lot of the proteins that we need for our daily lives, especially clotting proteins, the proteins that are circulating in the blood that helps us clot when we have a bleed. It also helps us regulate our blood sugar because excess glucose, once it's processed by the food that we intake, it's stored in the liver for later use when we're not eating. So it maintains the blood sugar at a certain level. It also produces a substance called bile, which helps emulsify and digest fats. It's also important in the clearance of toxins and medications and drugs that we take. A lot of, you could say close to 50% or more of the drugs and toxins that happen to come in our body are processed by the liver and safely expelled from the body. Also, it's related to the processing of ammonia. A lot of ammonia is produced from the digestion of proteins, and it's poisonous to our system. The liver also metabolizes that and excretes it out of the body. So it has many functions, all of which are important for daily living, processing all the proteins that are involved in your muscle production, all the enzymes that control your metabolism. It's a very, very important organ. Right?
Okay, very good.
Just some of the functions.
Just some of the functions. All right. And of course, like every other organ in the body, we can run into problems with our liver. And based on some of the functions you've mentioned,
yes.
Clearly, if our liver is not functioning to full capacity, we could experience some problems. Yes?
Mm-hmm.
Right. So let's talk about. Yeah. Now that we've established the importance of the liver in our body, let us talk a bit about the problems that we can encounter. And of course, it's important to remind our listeners, today being World Hepatitis Day, it is important that you pay attention to your liver. It's a very important organ, and so you don't want to have any problems. So, Doc, tell us a little bit about some of the problems that we can encounter with our liver that can be serious.
Okay. Well, as it pertains to the liver in the medical field, we call it generally liver disease.
Yes.
One of them includes hepatitis, which we'll focus on the talk today because it's World Hepatitis Day, and also they've actually extended to World Hepatitis Awareness Week, which started Monday.
Right.
Today being Hepatitis Day, just to focus on that specific disease. All right. But there are many different types of pathologies that can affect the liver. And to be specific on hepatitis, which is an inflammation of the liver, meaning the liver is starting to be damaged from cells being destroyed intrinsically, right? There's other diseases like alcoholic liver disease, which also is related to our liver damage, but we'll focus on what causes hepatitis. So hepatitis in most persons view hepatitis as a hepatitis B, which is caused by a virus. So hepatitis B in itself, damage from inflammation can be caused by in A to E, and some new strains being discovered. Bacteria can cause it, which is less common, but in our setting, a disease called leptospirosis can cause hepatitis, which is we see very commonly in our practice. Also, a parasite can cause it. Amoeba is less common here, but can be seen in other places or rural places. A parasite called amoeba that can cause liver damage. Other things that can cause hepatitis include alcohol. Most persons hear alcohol and they think about liver failure and cirrhosis, but in the early stages of disease, alcohol causes hepatitis, a type of inflammation of the liver, before it starts to cause scarring, which is the cirrhosis. There are other medications that can cause it. Most notorious is actually Panadol. Overdose on Panadol can cause inflammation of the liver. Some things like ibuprofen and aspirin in high levels can cause damage to the liver and cause hepatitis. When we refer to hepatitis as hepatitis day, what is specifically referred to in the international community today is awareness for chronic hepatitis, which is caused by hepatitis B and hepatitis C. Even though all these other things that I meant, it's usually in acute setting, which is for a short time, and people usually recover quickly. The hepatitis that's being referred to now is the chronic one, the one that usually persons have to live with for a very long time and can cause even more problems down the road, which is the hepatitis B and hepatitis C. All right. Some of the manifestations of hepatitis, like a lot of persons, some persons might be aware, some persons might not, but they start off with yellowing of the eyes. Some people start to feel very nauseous and constantly want to vomit. They have a constant dull pain in the right upper part of the abdomen. Right? Sometimes they can even start later down the road when the problem has gone on to the point where the liver is now starting to fail. They start to have swelling or also bleeding problems, swelling in the feet. Right? These are the kinds of things that persons can expect when we're talking about liver disease and hepatitis.
Right.
In our community, just would like to focus on things that are prevalent here, such as the hepatitis B and an infection which causes inflammation. A lot of inflammation is the leptospirosis, and also HIV in some of its presentations can cause hepatitis. Right.
Does the liver have the ability to regenerate the cells and so, in a sense, heal itself?
Yeah, Okay. So the liver has somewhat some authors in the medical community term as a intermediate range of regeneration, meaning that it has some capacity to regenerate itself once it has been damaged, but that
Okay.
capacity is not infinite. Um, so that beyond a certain point of damage, there is no coming back. Right, that's when we start to speak of things like liver cirrhosis,
Mm-hmm.
which is very, very common in the alcoholics who would have abused alcohol for many years and then to the point where the liver cannot sustain its function. And so much scarring that there is no actual practical functioning of the liver.
Okay. Mm-hmm. Mm-hmm. And of course, when there is no functioning, of course, eventually that person may lose their life.
Yes.
As it relates to, I just want to go back to hepatitis B a bit, and
Mhm.
is it contagious?
So hepatitis B is one of the viral causes of hepatitis that is spread through contact with tissue, mainly blood to blood transfusions. In this day and age, the most common form of transmission is placental, or from the mother to a newborn, right?
Uh-huh.
When they would have delivered. So a mother who has hepatitis can have transmission to their unborn child, and that's in this day and age the most common cause of hepatitis, new hepatitis. The advent of scientists and persons thinking ahead. That's why all our newborns, and that's the standard globally, all newborns are given prophylactically, whether or not mother tests positive for hepatitis. They're given prophylactically hepatitis B vaccinations on after birth, immediately after birth, right? The other form of transmission, which is blood to blood with persons using sharing needles. Luckily, in our setting, IV drug use, meaning drugs that persons use, heroin and sometimes cocaine, is not that prevalent. So we don't see that kind of transmission here. But in the wider world where it's a bigger problem, yeah, becomes a more important factor in terms of transmission.
Right. What about can it spread through sexual contact as well?
Yes, it can. Hepatitis can spread through sexual contact. Persons who are having unprotected sex can contract the virus because it's, again, when you're having intercourse, there's micro abrasions in the mucosal surfaces that come into contact that allow microbleeding and viral particles to be transmitted through technically what is considered an open wound, even though it's microabrasions.
Right. Uh-huh.
Right, and that still is an important mode of transmission.
Right. Clearly,
Almost slipped me there.
right. Clearly, there's some people who are probably more at risk. Who are the people who are more at risk of getting hepatitis B?
For the most part, is there is persons unhealthy sexual preferences in terms of promiscuity, having multiple partners, not having contraceptive barrier protection such as condoms, which promotes the likelihood of you contracting the disease like that. So persons who who are engaged in having multiple sexual partners, but also having a risk, and they usually, in our profession, when someone is seen to have one sexually transmitted disease, we test for all because they are greater risk for contracting more than one.
Okay. Great. And what are some of the symptoms? So someone who has hepatitis B, what do we look for? How can someone tell? What would they feel, and at what point should they see a physician? So the symptoms, and at what point should they decide, you know what, I think I need to see my physician?
Okay. Well, when it comes to hepatitis B and a lot of the pathology and diseases that affect the liver, some of them, they do have overlap, but in general, in the early stages, it's sometimes even difficult for the physician to tell, because in the very early stages of the disease, some people might just experience vomiting, right? And later on, they might start to feel some pain, some constant dull pain in the right upper part of the abdomen, just where the liver is located, all right? And in latter stages, when the disease is already well established, people start to get yellowing of the eyes and yellowing of the mouth and other mucosa that are exposed. It's mainly, it's more evident in the eyes because that's what people look at and what people pay attention to in the mirror. You look at your face, you might open your mouth and your tongue is yellow as well. Person's attention and alert to see their physician. Because nausea and vomiting can be caused by a lot of other things, but it's usually that specific symptom that alerts them.
Right. Also, as an aside, we know that the condition known as jaundice can also cause yellowing of the skin, the eyes, the palm of the hand, and stuff like that. Is it the same condition, or would you experience that condition as part of the symptoms for hepatitis B as well?
So, just to clarify and just to give general knowledge to the broader public. So what we call jaundice is our medical term for the yellowing of the eyes and the skin and the other mucosa that's associated with liver damage or breakdown of bile, which is what's causing the yellowing. So the jaundice and the yellowing of the eyes are interchangeable terms.
Okay.
So it is associated with hepatitis and other liver pathology.
Okay. So it doesn't necessarily mean that the yellowing is as a result of hepatitis B. It could be some other liver condition.
Yes, that's exactly correct. It can be some other liver condition, but you cannot rule out hepatitis as one of them. So someone comes to me with yellowing of the eyes and skin, we look at the liver primarily, even though some other conditions can cause it and some other conditions besides hepatitis, but that's one of the things that is in the back of our minds and that we investigate.
All right. And how is it diagnosed? So a patient comes to you and he says, doc, I don't feel well. I feel upset, nauseous. I'm getting a little pain in the stomach, and I don't feel well. What would you look for? Because you probably sense that there are a number of things happening in that region of an individual. So how would you go about diagnosing and concluding that that patient has a liver condition?
Okay. Well, generally, if these symptoms, when they start off with the nausea and vomiting, a physician in general, that hepatitis is not the first thing that is looked for.
Okay.
All right. If there is some risk factor that can prompt. Hello. You seem to lost me for a bit.
Yeah, you with me here? Yeah, you with me? Mm-hmm.
All right. So I was talking about how a patient like that, if they come in with nausea and vomiting, we call these symptoms very non-specific symptoms there because they are not pathologies related to other organs. But if persons, they are in the high-risk categories, persons who have unhealthy sexual practices, all right, they've been exposed to persons who might have, firstly, the number of blood tests that can point to that specific disease. We do liver enzyme tests, which are usually elevated remarkably when there's damage to the liver. So it's a test that is found in the blood that we do. Also another test that's found in the blood that tests specifically for antibodies associated with hepatitis B, which is a truly remarkable thing. So someone who contracts hepatitis, their body immediately starts to create evidence to we can look for that antibody in the blood and but as written, initially you would think that and you would start the workup with these blood tests to further screen and evaluate what it is that might be going on. But hepatitis would be included in that workup.
Right. Can you also test for the liver functions, whether or not some of the functions that the liver is supposed to perform, whether or not they're performed the way they're supposed to or not? Can you run tests like that?
So some of the tests that we do is to give we extrapolate the data and interpret the data. So the liver has some synthetic function. So one of the functions, there's a certain protein that's very important for carrying a lot of the nutrients and certain irons and other components and particles in the blood called albumin, right? When the synthetic function of the liver is low, meaning that the liver is already starting to have some level of disease, the level of albumin in the blood drops. Right? So that's one indication that the liver is having some problems. And another indication is we test. We have a coagulation profile, which is test the clotting factors. Some of the clotting factors that the liver produces. If the liver is already starting to have some damage, those tests would come back abnormal and deranged, meaning that the functioning of the liver is starting to decrease, meaning the clotting factors that that it produces is no longer in sufficient quantity to function normally. But more specifically, we have liver enzymes that can be found in the blood. In a normal individual, there's a certain level of those liver enzymes found in the blood. When the liver is damaged, the cells of the liver start to spew out more of those enzymes into the bloodstream, and it elevates into the thousands. And when that's markedly elevated, it screams to us that the liver is being damaged. And then finally, we use the serology test that's specific for hepatitis to get a confirmed diagnosis that it's a hepatitis B that is causing all of the problems with the liver. So it's a series of blood tests that we do, and we extrapolate the data to get the diagnosis.
All right, wonderful. Doc, we're going to take a commercial break. When we come back, I would like to speak with you on some of the treatments, and I also want to speak with you about hepatitis in women as it relates to pregnancy and other things like that. So we take a break and we'll be back with you in just a moment. Stay with us, folks. Don't go away.
Hills and Valley Med Care Center, located on Grenville Street, St. George's, has a highly professional team that gives excellent service in massage therapy, physiotherapy, speech therapy, medical consultation, and more. Hills and Valley Med Care Center sells a wide range of medical supplies, offers home visits for patients in Grenada and Carrier Crew, and opens Monday to Saturday, 10 a.m. through to 7 p.m. Visit or call Hills and Valley Med Care Center today, 435-6904.
How going on, boy?
Hey, good old things.
Hey, Daisy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex, or give them a call, 440-1015 or 440-1016. Or check out their website, hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
You're already ill and have no time or energy to walk every which way to access your healthcare needs. So come to Spice Isle Imaging on the Carenage for a one-spot stop for all your health service needs. See our in-house doctor and get your meds from the pharmacy right on location. Digital X-ray, MRI, CT scans, mammography, ultrasound, and laboratory services are also available. So for that moment when life makes demands on you, you can make demands on us. Visit us at Spice Isle Imaging, Carenage, St. George's.
It's what's inside that counts. Inside your house, that is. With Beacon, you can ensure everything inside your home with our Easy Buy contents packages. Just click, match, and buy for maximum peace of mind with minimum fuss. Log on to beacon.co.tt and choose your package today.
GBN Television News at 7, a pulse on all things Grenadian. Look out for our new features through expanded synergies with our media partners in Barbados, St. Lucia, Jamaica, Trinidad, and beyond. Capturing the latest in news, sports, weather, and entertainment. Credible, informative. Thank you for making us number one. News at 7, live, Monday to Friday on GBN Television, Channel 7 and 11. K105.5 and 105.9, Hot 98.5 and 98.7, GBN Television Facebook page and YouTube channel, and www.gbn.gd. GBN, with you anywhere and everywhere.
You've spoken, we have heard. Now we're making more time available for your evening primetime shows on K105. From Monday, July 6th, Your Law will air from 6 to 7 p.m. On Tuesdays, Simply Agriculture. And on Wednesdays, join discussions on constitution reform in partnership with Island Media. At 5:55 p.m., we bring you news headlines, a capsule on local, regional, and international events, followed by News at 7 via simulcast with GBN Television. television. Join Godfrey Augustine for stimulating discussions on Release It from 8 p.m. on Wednesdays and Thursdays. GBN's K105.5 and 105.9. We're with you everywhere and anywhere. If you're on the move, catch us online at www.gbn.gd.
Welcome back, folks. It's Doctor in Call with us, Dr. Devron Joseph, and we're discussing liver diseases with special emphasis on hepatitis. Doc, before the break, I mentioned a few things. I want to talk a little bit about gender here, male, female. Hepatitis B, is it more prevalent in one or the other gender?
If I'm not mistaken, no, there shouldn't be a gender preference for hepatitis B. The transmission for hepatitis B is usually through placental from mother to baby. But in terms of distribution, there's no gender disparity for the disease.
Right. What about some, well, let's call it natural processes? For example, in women who are pregnant, any chance other than, let's say, getting infected through sexual contact, they can develop the condition as a result of pregnancy?
No. As a result of pregnancy, no.
All right.
The only transition in pregnancy would be from mother to baby, right?
Right.
And outside of that, you would have to have had sexual contact or from a blood transfusion or be an IV drug user sharing needles with someone who has the virus and contracted it that way, and she happened to be pregnant. But outside of that, she cannot develop the condition all on her own like that.
Okay, so she would have had to have it before pregnancy. All right.
During pregnancy.
Or during pregnancy. All right. Okay.
Yeah. Good.
Right. So someone comes to you. They have all the symptoms. You've done all your tests. You check liver functions. You check antibodies. All of that. And you're in a good position to conclude that that person has hepatitis B. What do you do from there as it relates to treating the patient and advice and all of that? What do you do going forward?
Okay. Well, hepatitis B, it's generally, in terms of how long a person can have hepatitis B, sometimes hepatitis B can be an acute infection that's self-limiting, meaning it starts off as you contract the disease, you start to get the symptoms, and your body does its best and creates antibodies and able to fight off the infection. And that's it. You can be cleared of the disease, just like other viral infections like a cold, right? The thing about hepatitis B, it's one of the strains of viruses that have an affinity to the liver, that have a high tendency to be chronic, meaning that the disease, it starts off, it damages the liver, the body tries its best to eliminate it, but does not completely clear it from the system, and you will always have some latent form of the virus acting on the liver.
Okay.
It's close to almost a 60% chance of having chronic hepatitis once you've been infected with the hepatitis B virus. When it comes to treatment, it depends on the stage of disease. Hepatitis B, even though it starts to act on the liver, it's usually very slow, and the damage is usually very very insidious. So persons with hepatitis B, generally, what they are advised to do is to monitor the liver function. Right, when the damage is insidious and slow, they receive supportive treatment, meaning they make sure that we're not giving them medications that can further damage the liver. Right, they're not. They're asked to, if they're in full fulminant disease, meaning they're in acute hepatic failure, we bring them in hospital and we give them treatment in hospital. But apart from that, persons can live fairly normal lives with hepatitis B, just barring that they understand that the disease can be transmitted.
Okay.
The antiviral treatments that have been experimented with in some of the first world countries that help diminish the viral load, meaning the amount of virus circulating in the blood at any given time. But those are not standardized and available here. There's still not a consensus on how well to treat hepatitis B. Hepatitis C, on the other hand, has showed promise, and worldwide it's understood that hepatitis C can be cured.
Okay, lovely.
There are medications, and hepatitis C, with given the right treatment protocols, they have like a 95% cure rate on hepatitis C, right? Which is also one of the chronic diseases. Hepatitis B, on the other hand, is still in some work to do with treatment.
Right. Okay, fantastic. Now, as it relates to someone having the hepatitis B, what are the chances of that condition influencing other chronic conditions in your body? For example, having hepatitis B, can it also, let's say, create problems for you and your kidneys or your heart or some other organ in the body?
In general, with hepatitis B, your body is in like a constant state of inflammation. Okay. Specifically your liver, which predisposes persons to have their immune system and defenses down. They're more prone to becoming sick, usually from infectious processes, rather than processes affecting specifically the kidney or specifically the heart. So there's no direct link to the kidney and heart, but the state of having an inflamed liver and allows your immune system to be lowered and allows the body to be in a weakened state and be susceptible to other diseases and other inflammatory processes. So it doesn't specifically attack any other organ, but you're more prone to be affected by other infections and other inflammatory diseases.
Right. Can it also, or having that, can you also develop, let's say, hepatitis D or liver cancer?
So that's a pretty prudent question, and hepatitis D is one of the strains of viruses or hepatitis viruses that is associated clinically, and from what all research says, is associated with hepatitis B. Meaning you can only contract hepatitis D if you get it together with hepatitis B. So hepatitis D on its own cannot infect you. If someone has hepatitis D and you get a blood, you share the needle with them, or you have intercourse with that person, it's very low likelihood that you can contract hepatitis D by itself. But it has been shown that it's contracted with hepatitis B when both infections are on board.
Okay.
And what that does, the hepatitis D actually predisposes you to a more serious disease. Is more persons have fulminant, like hepatic failure, meaning in a very short space of time, their liver crashes. In a very short space of time, they could end up having very, very close to death experience in terms of their liver being damaged very quickly. That's it on basically on hepatitis D and B. Mm-hmm. When they're contracted, they must be contracted together.
Okay, but by itself, hepatitis D doesn't pose a problem. Okay.
No, it's like it's like sprinkling some pepper on top of the already cooked food. it's by itself it might not cause much damage, but when it's linked with the hepatitis B, they cause havoc.
Okay, okay. I understand. What about what about
cancer?
Yes, cancer and liver failure eventually.
So, hepatitis B being one of the viruses that cause chronic disease, they are prone for persons to develop hepatic cancer, primary hepatic cancer. It's the liver is in a constant state of inflammation, and so when it's repairing itself over and over, it can cause like mistakes in that repairing process, and abnormal cells start to proliferate, and you're at high risk of developing hepatic cancer from having chronic hepatitis B. Right? Also, the same goes with that same inflammation. Bodies being damaged, the liver being damaged over and over, and there's only a certain level of regenerative capacity, as I alluded to earlier, of the liver. Mm-hmm. So it regenerates until it cannot regenerate anymore, and then it leads to scarring of the liver, which we refer to as cirrhosis. Mm-hmm. The liver gets smaller, and if you remember what it's like to get a cut and your tissue is scarred, you get a scar tissue. It heals up, the skin gets tighter, but that skin, when you touch it, depends on which angle you touch it, feels numb. It's almost like a useless piece of tissue. So imagine that same process happening inside the liver, where scar tissue is replacing good functioning liver, and that space becomes useless. Eventually, the liver loses its functional capacity, and then you start to have the problems that we alluded to earlier: clotting problems, sugar problems with the sugar. It can regulate the sugar, and the swelling in the belly, and proteins being lost, and etc. So it's
all of that. Mm-hmm. What about in treating the condition? Let's say, for example, you have a certain part of the liver that is damaged. All right, so that part of the liver cannot function as it ought to. Can surgery, or let's say removing that portion of the liver, can it help?
So, as it relates to hepatitis, no, that is not an option.
Okay.
Hepatitis B being a viral infection that where the liver cells are actually store and house the virus. The virus has an affinity to the liver, so when you're infected, it travels there, it causes the inflammation, and it replicates itself within the liver. So it's practically inside the entire liver, damaging all little portions of it. Mm-hmm.
What about?
And so, treat surgery, removing any part of the liver would be futile.
Doesn't make any sense. Yes.
Practically in all parts of the liver.
Right. What about is there anything called a liver transfer? Can you you can do like kidney transplant or liver transplant or things like that. Can you do that with the liver?
Yeah. Yes, you can. In terms of treating someone who has liver failure or a liver that is cirrhotic and fully scarred. In the bigger countries, you have transplant centers where what they try to do is they get persons, they try to match persons who have hepatitis, donors who would have had hepatitis, persons who would have probably passed in a car crash and they're in comatose state, and the organs are up for donation, and that they try to match persons who already have hepatitis to the recipient. So they're both donors and they both already have hepatitis already have hepatitis B as a disease. So you're transplanting a liver that's not far gone to a person whose liver is far gone.
Okay.
And so that can help, but that procedure one is very it's not accessible to the everyday man, because it's transplant surgery it's cost hundreds of thousands of US dollars,
right,
and that's just for the surgery. And on top of that, you have tens of thousands of dollars of immunosuppressive medication that you have to be on to prevent you from rejecting the new liver. So liver transplant is an option in for those who can afford that kind of therapy. But in a realistic sense, it's an option for the ultra rich.
Right. Something that just came back to me. You mentioned earlier that in some cases, someone getting hepatitis B, the body can, create the antibodies and get rid of the infection. If that happens, does that mean that person becomes immune to hepatitis B, meaning that they cannot get the disease again?
That question, that's twofold, because the absolute answer is no.
Right.
That's not the case. But in the short interim, the virus, you can have months of antiviral protection, because when your body has an infection, it creates proteins that fight it off, and then afterwards it creates an army of these proteins, so that in the event that you again come into contact with the virus, that you have those antibodies to prevent an infection from establishing itself. So in the interim, the few months afterwards, you will have protection that will last for a couple months, but these antibodies will diminish over time, and then there will be a point where the titers of the antibodies would be so low that if an infection comes on board, the possibility that you can get it
again. All right. Okay, great. Let me just ask one quick question before we take our final break, and then we'll go to the telephone. Now, how can someone prevent hepatitis B?
Okay. Well, it's a sexually transmitted disease, so you follow healthy sexual practices, right? Meaning, try to have a stable partner, all right? Use barrier protection, such as condoms, right? So that you lower your risk of getting the disease. Right? As it pertains to the other mode of transmission, which is more prevalent, which is the maternal fetal transmission by the placenta. That's part of the screening that is done for all pregnant women. So persons who are pregnant, they need to get antenatal care, right? As early as possible. As soon as you find out you're pregnant, you're 8 weeks, 12 weeks pregnant, you need to see a physician so that they can start your antenatal care and screening process. Don't just go about the pregnancy without seeing a doctor until baby is ready to be born, because there can be many problems associated with that. So getting your antenatal care, your doctor would indicate screening, which will include a hepatitis B test, that you know what's your status, and that if you are positive, then measures would be taken at the delivery, so that baby has minimal chance of contracting at birth.
Okay, wonderful. So, Doc, we'll take our final break, and when we come back, we'll open our telephone lines to get some questions from our listeners and viewers. Stay with us. We'll be back with you in just a moment, folks.
Hills and Valley Med Care Center, located on Grenville Street, St. George's, has a highly professional team that gives excellent service in massage therapy, physiotherapy, speech therapy, medical consultation, and more. Hills and Valley Med Care Center sells a wide range of medical supplies, offers home visits for patients in Grenada and Carriacou, and opens Monday to Saturday, 10 a.m. through to 7 p.m. Visit or call Hills and Valley Med Care Center today, 435-6904.
Ovio.com. Sale. All the outlets, hotspot outlets. You're going to go to the Carnage, the Grenville, or the Sutter's hotspot, and you get sales and deals on all items. You can get these on potato, you can get these on saltfish, onion, garlic, mackerel, toilet paper, and we even have the currants and the raisin at $10 per pound, lowest price island-wide. So people just come down or go up or go across, but just make sure and go to hotspots.
You're already ill and have no time or energy to walk every which way to access your healthcare needs. So come to Spice Isle Imaging on the Carnage for a one-spot stop for all your health service needs. See our in-house doctor and get your meds from the pharmacy right on location. Digital X-ray, MRI, CT scans, mammography, ultrasound, and laboratory services are also available. So for that moment when life makes demands on you, you can make demands on us. Visit us at Spice Isle Imaging, Carnage, St. George's.
Let's Cook Grenada, a practical culinary guide to local cuisine. Learn new ways to prepare your favorite foods or try different menus from various locations across the island. Let's Cook, Tuesdays at 8 p.m. on GBN Television, Channel 7 and 11, GBN's Facebook page, and GBN's YouTube channel. If you miss it, catch the repeat Thursdays at 10 a.m. and Sundays at 3:30 p.m.
GBN Television News at 7, a pulse on all things Grenadian. Look out for our new features through expanded synergies with our media partners in Barbados, St. Lucia, Jamaica, Trinidad, and beyond. Capturing the latest in news, sports, weather, and entertainment. Credible, informative. Thank you for making us number one. News at 7, live, Monday to Friday on GBN Television, Channel 7 and 11. K105.5 and 105.9, Hot 98.5 and 98.7, GBN Television Facebook page and YouTube channel, and www.gbn.gd. GBN, with you anywhere and everywhere.
Hello and welcome to the OECS Link.
A conversation is a talk. It's important to know where we've been, to know where we're going.
Hello, Dr. Jules.
Hi, how are you?
Join us every week on this station as we build relationships that uplift our region. Find us on all social media platforms. The OECS Link is powered by Republic Bank.
You've spoken. We have heard. Now we're making more time available for your evening primetime shows on K105. From Monday, July 6th, Your Law will air from 6 to 7 p.m. On Tuesdays, Simply Agriculture. And on Wednesdays, join discussions on constitution reform in partnership with Island Media. At 5:55 p.m., we bring you news headlines, a capsule on local, regional, and international events, followed by news at 7 via simulcast with GBN Television. Join Godfrey Augustine for stimulating discussions on Release It from 8 p.m. on Wednesdays and Thursdays. GBN's K105.5 and 105.9. We're with you everywhere and anywhere. If you're on the move, catch us online at www.gbn.gd.
It is important to know what your road signs and markings means. The zigzag lines means you should not park in the marked area. Parking is allowed inside the solid white lines on the edge of the road. Remember, look out for pedestrians. Pedestrians, be sure the vehicle comes to a complete stop before crossing. These tips can save your life. These tips can make our roads safer for all users. Be safe, be seen, be smart. A message from the Traffic Department of the Royal Grenada Police Force.
Welcome back, folks. It's Doctor on Call. It is just about 22 minutes under the hour of 10 o'clock. And we will now go to our telephone line. We know that there are quite a number of people are waiting to get their questions in. So, Doc, we'll go to a telephone. We have a caller online. Doctor on Call, good evening.
Hello?
Yes, good evening. Go ahead, please.
Good evening, sir. The doctor is spot on. Doc, there's three matters. I'll have to take it slowly because they're kind of technical in nature.
Sure.
I have a family who had a liver transplant.
Mm-hmm.
And you're quite right in saying that it is expensive, one. And the follow-up, the medication that child has to use, it's for life and it's very expensive. That's absolutely, you mentioned that, and that is correct. Now, I wanted to, and she had that infection due to the liver was rotting. I want you to explain to me why the liver was rotting. That's the first point. The second point is that the hepatitis B, C, and D. What are the symptoms you have to look out for with such, with that type of virus? What symptoms are you looking out for when you have that virus? And the third one is, could cirrhosis of the liver, could it be reversed and your liver come back to normal? What procedure you have to go through, apart from a liver transplant, what procedure you have to go through to get the liver up and running again as a normal liver when you have cirrhosis of the liver? Thank you very much.
Thank you very much indeed, caller. Doc, you got the questions?
Yes, I think so.
Right. Mm-hmm.
So, as it relates to the first question, which is said that her liver was quote unquote rotting.
Yes.
So the rotting may have been a term that was really misused, but the liver, when it's being damaged, it's being damaged from three things: either infection, drugs, or there's also a third type of etiology called autoimmune, where your own body is creating proteins that damage the liver. All right. When someone describes it as rotting, that's very vague, and it's not really a medical term. Most likely she's had a chronic liver disease where it's being inflamed and the liver is in constant repair. There's another possibility where there's infection of the liver by bacteria, which can cause abscess, and many abscesses in the liver, some infections that are blood-borne and end up establishing itself in the liver and cause abscesses. That's the closest that can come to rotting, but usually it doesn't lead to terminal liver failure or the need for transplant. So as it relates to rotting, it's very unclear as to why they would use that term, but what's normally seen in our profession is chronic liver disease, chronic hepatitis, and if it's not that, it's usually autoimmune hepatitis where the body is attacking the liver itself. But the term rotting, that's a term we don't really use when it comes to describing liver disease. As it relates to the symptoms of hepatitis B, C, and D, the symptoms are very common. The most specific one is the jaundice, which is the yellowing of the eyes and the tongue and on the mucosa and the skin, right? But you can have in the early stages of the disease, like nausea, vomiting, and like I said, pain to the upper right part of the abdomen where the liver is located. There are other diseases that can present like that, but hepatitis from these viruses usually present like that. In the chronic form, it might seem very, very minuscule because the pain is not usually the pain that prompts you to go to the doctor. It's just a nagging pain that just they think it's beyond their control. As it relates to the final question, which I think I lost the viruses. Oh yes, the last one was relating to cirrhosis and reversal.
Yeah. Mm-hmm.
So once the liver has gone to the stage where we call it cirrhosis, that is beyond repair, right? So there is no other course for treatment but a liver transplant. So there is no repair beyond that. Like I said, the liver had a certain level of regenerative capacity, which at the time when it reached cirrhosis, that answers your questions.
All right. Yes, indeed. Let's go back to our telephone. Doctor and call. Good evening. Yes. Good evening.
Hello. Good evening.
Yes. Go ahead, please.
Doctor. Good evening, doctor.
Joseph.
I'm diabetic. And I'm wondering if diabetes cause hepatitis B.
Okay.
Thank you, caller.
All right, thanks for your question. Well, the straight answer is no. The two diseases are not completely unrelated in that diabetes is a chronic disease just like chronic hepatitis B, and can cause your immune system to be lower and make you more susceptible to infections and acquiring diseases. But just having diabetes on its own can't cause hepatitis. All right?
Okay. All right. The number is 435-2041. Of course, you can get to ask your questions. Doc, while we wait on the other callers, as it relates to regeneration of the liver and the liver losing that ability to regenerate, does age have anything to do with that? Or is it strictly because of lack of proper care for your liver?
no. Age contributes to everything as it relates to the human body. All right, but it's not the primary factor, but age does contribute to it. A younger liver is fresh off the market and can sometimes take a beating. Right, so we have all these young folks who, hanging out at the rum shop and
yes,
their liver can take a beating, right? But eventually, what happens is that liver gives up. But as you grow older, in general, your organ structures they start to lose some level of functionality as you grow older.
Okay.
Your body is a machine that's always up, always functioning. Even though your brain takes a little rest, the rest of your body just takes a little. It goes slow, but
keeps going.
Never shuts off.
Keeps going. All right.
It never shuts off. So age does lower the regenerative capacity of the liver, but it's not the main factor. The main factor is what any insults to the liver, any viruses, infections, any medications or drugs that you overly used, or drugs such as alcohol that can damage the liver. That's the main factor when it comes to the health of your liver.
All right, let's get back to our telephone. Dr. Nicole, well, we seem to have lost that one. There's someone who's asking a question via social media, and the question is, what's the best way to take care of your liver? And they're referencing foods. So as it relates to foods, what might be the best foods to use to ensure that your liver is in excellent condition?
Okay. Well, when it comes to your liver, there is no specific diet other than having a balanced, healthy diet for your overall health, right? In terms of the amount of carbs we consume, that is almost like an epidemic in most countries, where we are consuming a lot of carb-laden foods and not enough foods with fiber, and not enough foods that have all of our macronutrients.
Right.
We're usually not consuming the best foods for our entire body. So when you take care of the entire body, meaning you make sure you have enough protein in your meals, balanced with carbs, and a lot of vegetables, and to bridge the gap in terms of your micronutrients and all your vitamins. When you get a diet like that, it benefits the entire body. But as it relates to specific foods for the liver, there may be some persons who are dedicated to alternative medicine who might have a more specific answer for you, because when it comes to the type of medicine we practice, which is Western medicine, which is based on traditional teachings in med schools, we don't have a specific answer for that. So you might want to think about just if the herbalist might have a specific plan that might help with the liver. That's all possible.
Okay.
So I'm not negating that might be an option.
Let's get back to a telephone. Dr. Nicole, good evening.
Good evening. How are you?
Very good. Go ahead, please.
Right. Well, good evening, Doc. Sorry. What are some of the signs of liver failure? Thank you.
Thank you.
All right. Good question. Well, liver failure. One of the signs is that yellowing of the eyes that we described, jaundice. And another sign is something called spider angiomata. Some people, normally your palms, there's, especially in persons of Afro-Caribbean descent, your palms are of a certain color. Some persons, their palms start to get really red and start to have these kinds of markings, almost like spider veins. It's a little They look like almost like little spider joints on your hands and sometimes your belly. Your belly can start to swell, right? You know, I'm imagining someone who's known their abdomen to be a certain size, and it starts to increase in circumference over a period of weeks to months, right? Another sign is swelling in the feet, although that can be caused by many other diseases, and liver failure is not the first one, but when it's there and it's associated with all the other signs, it's usually from the liver failure. You can have bleeding problems, meaning you get a cut and it's difficult for the cut to clot in the time that it usually takes to clot. So you have bleeding issues. You might start having bleeding more when you brush your teeth, or bleeding more when you might bleed from the rectum. Other problems that you might start to have is problems controlling the blood sugar, right? Because the liver is responsible for maintaining your blood sugar when you haven't eaten, because it stores the sugar and it releases it at a time when you need it and you haven't eaten. So there are a plethora of symptoms, but the main ones would be the swelling of the belly, the yellowing of the eyes. Sometimes you might start off with these spider veins that you might see all over all over your tummy and also in the palms of your hand. Also, you might, especially for the men, who men generally don't have breast tissue unless you're unless you're overweight, right? So some men might have increased size of the breast tissue, but barring that, imagine a thin man having increasing breast tissue size. That's also
something is wrong. Okay, let's go back to a telephone. Doctor on call, good evening.
Hello, could you ask the doctor if an ultrasound would be able to detect how my liver functions?
Can you repeat the question, please?
If an ultrasound could detect my liver function?
Okay.
Thank you, yes. Whether an ultrasound can detect whether she has a liver condition.
Okay. So ultrasound is very useful for us in evaluating the liver. It's the liver is a solid organ, and the ultrasound is a good modality of evaluating the liver. It's not absolute, but it gives us the visual appearance, a visual estimate of what the liver is doing, right? So in terms of the liver function, we use the blood test to evaluate the liver function itself, right? And if it's failing. But we use the ultrasound to give us an idea of why it is that the liver is failing. So sometimes the ultrasound can tell us if the liver is small and nodular and has an almost sandpaper-like appearance, it points towards cirrhosis, right? Also, if the liver function test is abnormal and the ultrasound can show us a mass in the liver, which might be suggestive of some cancerous etiology, or liver cancer, or some other cancer that metastasized to the liver, causing problems. All right. So generally, the ultrasound is part of our evaluation when we're working up liver disease. But specifically to your question, it doesn't test specifically the liver function, but it's important in the evaluation of the liver.
Okay, wonderful. 435-204. We have time for one final call. If we get that call, we'll take it. If not, Doc, we can just quickly summarize what we spoke about, the importance of the liver, and the fact that today being World Hepatitis Day, just briefly encapsulate what we spoke about.
So So today is World Hepatitis Day, and the week starting from the 27th all the way down to August 2nd is World Hepatitis Awareness Week. Like I said, hepatitis is inflammation of the liver with specific focus to hepatitis B. It's a chronic infection of the liver where it cannot be cured, but just managed, right? The signs and symptoms include nausea, vomiting, pain to the right upper part of the abdomen, and specifically yellowing of the eyes and skin and other mucosa, which is called jaundice. All right. When you start to experience these symptoms, you want to contact your physician so they can do a workup. They will get some blood tests for you. They would get an abdominal ultrasound done, and they will evaluate why it is that you're having this problem. And if it's hepatitis, if that's the case, they will direct you accordingly to treatment. You have complications of hepatitis include liver cirrhosis, which is very common, where the liver is scarred to the point where the liver starts to fail. All right. There is also, you can go into acute liver failure when you start having even seizures or even acute problems like abdominal pain and blood clotting issues, where you need to get yourself to hospital as quickly as possible so that it can be evaluated and treated. All right.
Okay.
Hepatitis B is preventable, all right, in that you have healthy sexual practices and you lower your chances of getting it. And to the mothers out there, seek early antenatal care so that doctors can screen for it. In the event that you have it, that they can take precautions so that you won't pass it on to baby.
All right. Yes, indeed. Well, Doc, that's all the time we have on the program this evening, and I thank you so very much for accepting our invitation. And I will be calling you again, definitely. I will be calling you again because it's important that we share information with our people. So thanks so much again, and we really do appreciate your presence and sharing with us such pertinent information.
No problem.
Yeah, and of course we look forward to having you again. So thanks again, and do have a good evening, or enjoy the rest of the evening.
All right, thanks very much.
All right. All the best. Thank you very much.
All right.
Okay, folks. That was Dr. Devron Joseph speaking with us this evening on liver disease with special emphasis on hepatitis B. Today is World Hepatitis Day, and I just want to leave with you the importance of preventing hepatitis B. You heard it from the doc. Be careful with your sexual practices. And of course, mothers, those of you who are pregnant, it's a good idea to have yourself screened to ensure that if you do, it's not passed on to the young one. So thank you once again for staying with us. That's our program this week. You can join us next week for another Doctor on Call. Tomorrow I'll be back. It's Wednesday. We have our constitutional educational program from 6 p.m. And following that, we'll have Release It. Yes. On Thursday, there will be no Release It program again because we will be having another program with the ECCB. So that will be on Thursday from 8 o'clock. All right. So we have no Release It on Thursday, but tomorrow we do have our Release It program. So thank you once again, and do have a good night.
Drug abuse, cancer,
measles, diabetes, AIDS, cancer,
jackpot money. More reasons to play this game. More money for way. Super